start recording this. I am aware that we're a little bit late starting, so I'll keep an eye on the waiting room there. If anyone else arrives, they can just pop in late. So what we're going to do today is we're going to start our the anatomy portion of this module. So just a quick recap: we have one lecture a week where we're all together, and we have two tutorials. One of the tutorials is going to be used up doing a little bit of a deeper dive maybe on one of the topics that we've talked about in the lecture, and we'll do a little bit of anatomy revision. We'll pick that up next week. And the other practical is going to be covering new anatomy contents. So, sorry, I have someone there. So today we're going to start dipping our toe into the anatomy content. Now, before we start, I want to share my screen. So I have a couple of things that I want to share with you guys. Okay, so okay, so hopefully you should see your screen there. Now I want to remind you that we need to, I want you guys to enroll on the Moodle module for this, the Moodle page for this module. So if I just click into my participants there, I can see, yeah, a good few of you got the message, but I definitely don't have everyone there yet. So if you haven't already done so, what you need to do is you need to log into Moodle. You need to go to the Introduction to Sport and Exercise Science module page, and you need to go through the self-enrollment process. I've sent you all an email to your WIT student email accounts. If you didn't get that, or if you're having trouble accessing it, you can contact me on my email, which is bwardrop. That's BWARDROP at wit.ie, and just let me know. But get yourself enrolled on the module, because I'm going to start putting content up. So when you're on the module page, it will look like this. There's a brief introduction at the start. You have your Zoom links in one tab, and then here in this little card, if you click on that, we're going to start adding in the anatomy content that you can revise and study into that one. When we're, for the first couple of weeks, when we're talking about anthropometry, we'll be putting it in there. When we move on to physiology, we'll be populating this one, and so on as we go through the module. So it's important that you have access to Moodle, so make sure you go and do the self-enrollment process. Okay, so that's just a little bit of housekeeping. So today, as I said, we're going to progress on. We're going to talk about our anatomy. Now, I want to just double check if I share this with you guys now. Can you see a skull on the screen? Yeah. And if I move him there, is he moving in real time? Can you see him moving around? Yeah. Okay, great. Because I'm going to go back and forward between the anatomy software here to help illustrate some of the stuff that I'm talking about. We'll be using that in a bit more detail in the coming weeks, and we'll also be looking at a presentation. So I'm going to go back to the presentation there. One other thing that I want to make you guys aware of is Quizlet. Have you guys, I don't know if you guys have used Quizlet before, or if you've come across it, but it's a little kind of teaching resource or learning resource for you guys. So each week I'll be creating a Quizlet, and a Quizlet is basically a set that can help you to revise. So it will have a set of flashcards. So we can see here, we've got a term here. If we click on that, it'll tell you what that term is. Okay, there's also the flashcards are maybe easier to see here, so we can go through a load of flashcards that you'll have each week, and then there's other things that you can do. So you can take a little test on the stuff that we've covered each week. So these are very similar to the type of questions that are going to come up in your exam at the end. You'll be able to practice them week by week, chunk by chunk as we go along. And we're also going to do some live quizzes. So I'm going to actually try one of the live quizzes now. It's just a little 10-question quiz, and it's just to kind of gauge where you guys are. Some of you may have got some previous knowledge in this area. Some of you may have done some other courses before you came here. And I just want to kind of gauge where you're at in terms of your anatomy knowledge at the moment. So what you guys do, if you have your phone or your laptop open in front of you, I'm going to just let you play as individuals. Oh, Jesus, that was loud. Okay, if you guys go to quizlet.live and enter the code that you see on the screen there. So quizlet.live and enter the code 621765. Okay, Beth, you've just joined the room there. So what I want everyone to do, Beth, is just go to quizlet.live and enter the code 621765. Mutual there. So we've got 12 people are in so far. There's 17 in the room, so just see if we can wait until everyone gets in. Quizlet.live 621765. You can use your phone, you can use your laptop to join. $14, couple more. If anyone's having trouble there, pop a question into the chat. I'll just wait one more minute and then I'm going to start this off. So when we're doing the quiz here, if everyone gets zero and gets no questions correct in this quiz, that's absolutely fine. If you do fantastically well, that is also fine. This is just a little test run to see, will the Quizlet work? Normally I would do this live in the classroom with everyone in front of me. So I just want to check how well it works when we're doing it here online. And as I said, it also lets me gauge where you guys are at the moment and make me pitch my content a little bit more appropriately. So we seem to be stuck at 14 players there, so we'll get it cracking. So what I'm going to do is going to start the game off. What you'll see is your little question will come up on the screen, and there should be multiple choice answers. Pick the answer that you think is correct, and we'll move on to the next one, okay? So I think we got one. Okay, you can see it's anonymous there, so no one knows how you're getting on. If anyone else comes along, Quizlet.live and enter the code 621765 to join. Okay, Siberian tigers there off to a good lead. Pressure's on though. Don't want to drop them back to zero. Okay, it's first to 10. Once one person gets 10 points. So Siberian tigers, the pressure is really on you there now. Bears and pumas making a run for it. Congratulations. Okay, so we had one person get to 10 reasonably quickly there. But what I was hoping for and what I did see was a number of you getting some of the questions right and then a couple of questions wrong and falling back to zero there. So that lets me know, based on the questions that I put there, that you guys aren't completely clueless when it comes to this, and I'll continue to try and make sure that I'm pitching it appropriately as we go along. So what we'll do is we'll just get this PowerPoint up and going. So this is Anatomy Tutorial 1. And what we're going to start doing today is talking about some of the basics when it comes to anatomy. Now, one of the first things that we need to do is to be able to describe the body and describe where things are in relation to one another in the human body. And we do that by first of all referring to the anatomical position. So the anatomical position refers to the body when it is standing upright with the feet approximately shoulder width apart, toes pointing forwards. The knees are soft, slightly bent. The arms are by your side with the palms facing forwards, and the head is up with the eyes looking forwards. Now this is important because it gives us a fixed reference point that we can use to then describe everything else in the human body. So we have that, you can see on the screen there, that anatomical position. If everyone has that fixed in their mind when they're trying to describe the human body, then everything starts to make a lot more sense. If one of you guys was trying to describe the body while it was in that position, and if I was trying to describe the body while my hands are up over my head here, we're going to start to get confused, because if I was trying to describe the position of my hands relative to my shoulders, things are going to change. So this fixed reference point is very, very important for when we're discussing the location of different body parts in relation to one another, and also when we discuss how things move in relation to one another. Oh, can I check the waiting room? Yes. Oh, Sheen, welcome to the room. Sorry for leaving you hanging in the waiting room there. So what was I saying there? Yes, so this anatomical position, it's a fixed reference position, and it allows us to all have the exact same figure or position of the human body in mind when we are discussing where everything is in relation to each other, or how we discuss movement. Now this is going to become important. It's obviously critically important if you are a doctor or a medic or someone, or if you're doing surgery on someone. You need to know very, very precisely where every structure in the body is in relation to one another. It's also important to you guys when you progress on to do your resistance and conditioning, your strength and conditioning modules, that you understand where the different body parts are in relation to each other, how they move. We're going to look as we progress through this module about the different the different muscles of the body, where they are located, how they function and operate in relation to the joints that they cross over, how they create movement. And if you want to prescribe exercise and teach someone else in the waiting room, if you want to prescribe exercise, and if you want to be able to instruct someone effectively how to move well, you need to understand these things. So first up, we've got the planes. The planes divide the body up into different portions. There's 3 main planes that we use in the human body. The first one is called the sagittal plane, and it simply is a straight line, as you can see there, that divides the body into left and right sides. These don't have to be exactly equal, left and right sides. So that pink card that you could see there, that as it stands there, it's dividing that body into equal left and right sides. It's going right down the midline of the body, but we could shift it over so it's passing through a shoulder, and it's still called a sagittal plane. It just doesn't divide the body into equal left and right sides. If we want to get very specific, we have the mid-sagittal or median plane, and that is the same plane, but it divides the body into equal left and right sides. So that allows us to describe things, describe where things are in relation to the midline of the body. That becomes important when we're talking about movements. Say if you were, you can just about see me there, if you were talking about a lateral raise, a shoulder move exercise, where your arms are moving away and to and from the midline of the body. We have the median plane, sorry, I beg your pardon, the frontal plane divides the body into front and back, anterior and posterior portions. It's sometimes called the coronal plane, and it runs perpendicular, which means at a right angle, to the sagittal plane. So you can see there, that one divides the body into front and back. And the last main plane that we have is called either the horizontal or transverse plane, and it divides the body into upper and lower parts. It runs parallel to the ground. So the three main planes, sagittal plane divides the body into left and right, coronal divides the body into front and back, and the horizontal or transverse plane divides it into upper and lower portions. Okay, so you will need to know the definition of each of those planes and how to describe them. So from this anatomical position, if we want to describe where things are in relation to one another, there's a set of terms that we use. Some of these you'll have come across before, some of them you may not have heard, but they generally run in pairs, okay? And they are linked back to the planes that we've just talked about. So first of all, we've got superior and inferior. Superior means something that is towards the head, and inferior is the opposite. It means something that is towards the feet. Anterior and posterior. Anterior describes something towards the front. Posterior describes something that's towards the back. You've probably heard of those terms before. The next two, medial and lateral, may be new to some of you. Medial means something that is towards the midline of the body, and lateral is something that is further away from the midline of the body. So superior, inferior, anterior, posterior, medial, and lateral. We're going to come back to these, and we'll be referring to these fairly consistently throughout the module. We also have some other ones that you may not have come across before. Proximal means nearer to the trunk. Now, that is sometimes, proximal and distal. Proximal means near to the trunk. So the trunk is the core of your body, your chest, your abdomen. That's what we refer to your trunk. And distal is something that's further away from the trunk. We use those terms generally when we're talking about your limbs, so your arms and your legs. So again, if I was to describe the position of my hands, I'm not in the anatomical position here because I can't get that into the screen, into the camera, but in the anatomical position, my shoulder is proximal to my hands. So my shoulder is nearer to the trunk compared to my hands, and my hand is distal to my shoulder. So my hand is further away from the trunk than my shoulder. So that pair of words we generally use when we are discussing the arms and the legs, something that's near to the trunk or nearer to the body and away from the body. The next pair, superficial and deep. Superficial means something that's towards the surface of the body, and deep means something that's away from the surface of the body. So if we just, if you bear with me here now, this one's sometimes a little bit hard to wrap your head around, but if we go back to my skeleton here, so hopefully you guys can all see the skeleton on the screen there, is that right? Give me a thumbs up if you can see him. Yeah, okay. So this model is pretty cool because I can start to add different layers into it. So what we've got there is just the bare bones skeleton. And if I start to add some muscles in on top of this, we can see different layers of muscles starting to appear. Okay, these are all layered up on top of each other. until we have the complete musculature system superimposed on top of our skeleton there. So as we go through this, we'll be able to pick out individual muscles, and we can look and see what they do, where they're located. So for example, there we've got the pecs. But what we want to do at the moment is just describe these muscles. So this layer that we're looking at here is the outermost layer. So these are the ones that are closest to the surface. So these are the superficial muscles. These muscles are more superficial. If we were to start stripping back the layers, so if we take these ones away, we are now starting to look at the muscles that lie deep, okay, further away from the surface of the body. So we can see as we strip back the layers, we've got muscles that are deeper and deeper down into the body until we've taken them all away. So these are deep, and we're moving more superficial. So these are layered on top. They're getting closer to the surface of the body. As we take them back, we are looking at the muscles that are more deep, okay? So particularly when we're talking about, say, your core, we can see here we've got some of your transverse abdominis muscles there. If we add the next layer in on top, we can see your rectus abdominis muscle coming in on top of it there. And then if we layer more in on top of that, oh, sorry, I've knocked them all off. If we start layering the muscles in on top, we see that we've got obliques then that come in on top of your obliques at the side, and connective tissue here that lie on top of your abdominal muscles. So when we're looking at your core muscles there, there's a whole range of them. Some are deep, some are superficial. So that they're important ones important to be able to define the difference between superficial and deep. Then finally, the last pair we've got here are superficial and prone. So something that is supine means it's face up. Something that is prone means that it's face down. So again, we can use that to describe the position of the body. Oh, I'll go back to my presentation. So supine and prone, face up and face down. So if you were to do a sit-up, you are lying in a supine position. If you were to do a press-up, you are in a prone position, lying face down. So I'm not going to go through them all here now, but on this slide, and you'll be able to look back on this slide here, we've got examples of each term, a definition, and what it means. So if we were to use superior and inferior, superior means towards the head. Your collarbone, so the collarbone is the bone that is at your collar here, is superior to your hip bone. Okay, it is towards the head compared to your hip bone. And then the opposite of that, inferior towards the feet. The hip is inferior to the collarbone. So these terms all allow us to describe where things are in relation to each other, describe movement, describe the position of the body. Okay, quite important as we move through your modules. Right, so let's look at the skeleton in a little bit more detail. So the skeleton is a framework of about 206 bones in your body, and it has 5 main functions. The 5 main functions of the skeleton are: 1, to provide support. So it's a framework, it's the scaffolding for your body. It supports the soft tissue, and it provides a point of attachment for the tendons of most of your skeletal muscles. So in order to generate movement, your muscles are going to be attached to the skeleton at 2 points, and they'll cross over a joint. One end of the muscle, when the muscle contracts, it shortens and it pulls the distal end of the muscle towards the proximal end of the muscle. So when we're talking about your arm, if we're talking about your bicep, the muscle in the upper arm here, as it shortens, it pulls the distal end. So this is your forearm, this is distal, more further away from the trunk of the body, towards the proximal end, and it creates movement. So the support and stability and structural integrity that it provides is key to allow us to stand up and to allow us to move. The skeleton provides protection, so it protects many internal organs. The obvious one there is, say, your skull protects your brain. You've got your rib cage and your sternum protecting your internal organs. It also, as I mentioned there, provides assistance in movement. The skeleton is a site of storage. So we've got many minerals, calcium and phosphorus being the main two, are stored in your bones. And then finally, your bone marrow, all of your red blood cells are all of your blood cells. So your red blood cells and your immune cells, your platelets, they are all produced inside your bones, in your bone marrow. So that's where your red blood cells are produced, and then they're released out into the circulation. So 5 key functions for your skeleton there: support, protection, movement, mineral storage, and blood cell production. The correct term for blood cell production there is hematopoiesis. When we talk about the skeleton, we've got various different types of bones. Again, you'll need to be familiar with each of these types of bones. First 2 pairs we got here are flat bones. Are they the first 2 I want to discuss? Sorry, no, skipped a slide there. We've got, when you think of a normal bone in the body, you think of a long bone. So these are the body's levers. They allow movement, and you find them in the limbs. So the bones of your upper arm, your lower arm, your upper leg, and your lower leg. They're that kind of traditional cartoon bone-shaped bone that you think about. They're long bones. Then, conversely, if we have long bones, we also have short bones. These are strong, compact bones, usually grouped together in areas that don't require too much movement. So if you think about your wrist and your ankles, you've got a load of short bones in a small area there. We've got flat bones. These are, again, protective bones with broad surfaces that allow big muscles to attach onto them. So a good example of that is the shoulder blade or your sternum, your breastbone. We've got a very specialized kind of bone, your sesamoid bones, and they are bones that are formed within a tendon. So your kneecap there, we can see it in the diagram, is a sesamoid bone. It is formed within the tendon that that comes from your quadriceps, and it's totally encased within that tendon there. It doesn't sit outside that at all. It starts off as a very, very soft piece of cartilage when you're a baby, and as you grow and develop and mature, it turns into a hard bone. The patella is actually very, very important for when it comes to movement of the leg. I have a little video that I'll show you in one of the later lectures that shows you why the patella is important. We have another sesamoid bone. It's called your hyoid bone in your neck. Again, it's a little semicircle shaped piece of bone that is just found in the cartilage in your neck, and it helps to keep your trachea, your windpipe, open. And then finally, we've got irregular bones. And irregular bones are the bones in the body that don't fit into any of the categories that we've just talked about. So we've got the bones of your spine and your jawbone, your mandible. So they're not long, they're not short, they're not flat, and they're not sesamoids. They're just irregular in shape, and they don't lend themselves well to any of the other groups. We're just coming towards the end there of what we want to cover today. So if we talk about bone tissue, all types of bone contain 2 types of bone tissue. You've got compact bone, that's the outer surface or outer structure of the bone, and it is that's the hard outer surface. And then inside your bone, you've got spongy bone, which is obviously not as hard as the compact bone. It's spongy in appearance, so it has larger holes, and it is found deep to compact bone. So compact bone is superficial, spongy bone is deep, found on the inside of the bone. So not all your bones aren't all uniform all the way through. There's 2 different types of bone tissue inside them. Now, the last little bit I want to cover today is specific to long bone structure. Now, there's a good bit of detail here on this slide. If you are comfortable with everything else that we've done up until now, have at this, that's great. If so far you've found, it's a bit, you've had enough so far, this is not super critical information. This is nice to know, good to know information, but it's not super critical information. So when we look at the long bone structure, we've got different parts to the bone. The first part of it is called the diaphysis, which is the long shaft of the bone there, the long middle portion. At either end, we've got two epiphyses, okay? And the epiphyses are the parts of the bone that actually do most of the growing. When you talk about your growth plates, they're found in the epiphysis. They're specifically called epiphyseal discs, and they seal up when your bone is finished growing, and kind of take on a more spongy or compact bone-like appearance when they're done. At either end of the bone, you've got articular cartilage. So the outer surfaces of the epiphysis are covered in cartilage, and what they do is is to facilitate movement. So it gives some protection to the bone where it meets another bone. So if you've got two bones sitting on top of each other and moving around, the articular cartilage there is to provide a smooth and lubricated surface that reduces friction and wear and tear on the joint. If you get damage to your articular cartilage, you have arthritis. So arthritis is when these nice, shiny, smooth articular cartilage surfaces get damaged. They, over time, with wear and tear, they get rough, they start to break down, and they are less smooth, and they don't allow as much movement. And that's when your joint movements, joints can become stiff, they can become painful, and it is a very uncomfortable condition to have. On the very, very outside of the bone surface, we've got a sheath, a tough sheath called the periosteum. And this is where your bone does some of its growing. So it's got bone forming cells there, osteocytes, and it allows the bone to grow in diameter or thickness, but not length. So when you do strength training, when you do weight bearing activity, it's not just your muscles that will get stronger, your bones will also get stronger too. So they get more dense, and they become tougher and stronger and able to sustain or uphold greater loads. And it's the outer layer there, the periosteum, that gets stronger, that gets tougher, and responds to that stimulus. And then finally, on the inside of it, you've got your medullary cavity, and that's where we find your bone marrow. And on the image there, you should see a little blue vein and a red artery coming out. So your bones actually have loads of little holes in them where there's blood vessels that go in and out to the bone marrow in the middle. We said the bone marrow is where your blood cells are produced. So the blood flow, there's blood flow to and from the inside of your bones. It's not just one little pair like this. This is happening all the way around the bones, and that allows blood supply to the inside of the bone to feed, nourish, and retrieve the blood cells that are produced within. So that's just a little bit of advanced stuff about the structure specific to long bones. They're very important bones in the body. As I said, the ones that facilitate movement. So I just want to go back to this guy here. So when we look at our friend here, we can see, I'm just going to close down some of these so I can see a bit better. So we can see there, we've got long bones. They're fairly obvious. They're the ones we're used to thinking of when we think about a bone. So things like your upper arm, your forearm, your upper leg, your lower leg there, they are all long bones. Short bones then, if we were to get rid of that one, if we were to zoom in and have a look at your wrist. So we can see here that your wrist is actually made up of many, many small, short bones. So we've got two long bones here, and in your wrist, you've got a series of short bones that form your wrist. So they allow some movement, but not a whole lot of movement in that area. We've got flat bones. So if we zoom back out there, and we take something like your sternum. So we've got this guy here in the middle is obviously a big flat bone in the center of your chest there, and that allows for a site of attachment for your pecs, and it protects the structures that are underneath it, your heart and your lungs. If we were to spin him around there, we can see your shoulder blades. So this bone here, your shoulder blade, is a large flat bone. Lots of the muscles of your back attach onto that there. The sesamoid bones, we've got 2 of those. So you see here underneath your jaw, we've got your hyoid bone. That is a, sorry, it's a bit slow to respond. That's a sesamoid bone that sits in underneath. It's in your neck there. It holds your windpipe open there. So if you were to add in the respiratory system, we can see there, that's your trachea. So that's your windpipe coming down here. And we can see that your hyoid bone sits on top there and holds your trachea open. And we said you've got 1 more down in your knee, which is obviously your kneecap. So your kneecap there is another sesamoid bone. So it's just floating on its own there, not really in contact with any other bones in the area. The last 2 then we want to go to, or sorry, the last 1 rather, is your irregular bones. So we have a good few irregular bones in the body, but the bones of your spine are irregular bones. So if we were to pick one out, isolate that guy, so we can see here that that's an individual vertebrae there. So it is not long, it's not short, it's not flat, it's not a sesamoid bone. It doesn't really fit well in any of the other categories that we've been talking about. So it's an irregular bone there. And we've got obviously all the bones in your spine. We've got things like your jawbone is another, your mandible is another irregular shaped bone there. So that's where I want to park it for today. We are just gone past 10 o'clock. What we'll do is I will put this presentation and video up on the Moodle page. So if you want to review it in your own time or see any more detail, you can do that. I will also put a Quizlet up there that you can start to use. All of the anatomy content is going to go into the, all of the anatomy content is going to go into the anatomy tile here. So we'll be populating that every week. And then the anthropometry, we'll be working on that for a couple of weeks. We'll be working on this for a couple of weeks in the lectures. Anatomy will all go into 1 tile here. So everyone happy with that so far? Yeah, everyone stay awake? Zach, just about awake there. Yeah. Oh, how you doing? Yeah, welcome to us. So that's where we'll leave it today. So I will see you guys on Monday morning, 9:25, where we will start our anthropometry lecture. Okay. Thank you very much, guys.